There are a couple of possibilities. One is false negative to begin with. The false negative can be due to different detection method. And then the other one could be a sample timing. As I mentioned that as the disease progress, if you check one location negative, but it may not mean all locations negative. So that's a false negative possibility. The other one will be that if you looking at one sample, for example, the early stage, you look at the upper tract infection, you look at the upper tract, and a later stage, you look at a later, deeper lung infection, you look at the bronchoalveolar lavage fluid, or simply we can put like a lung wash. You look at this, and different locations and different timing, and also lastly, for example, there could be relapse, that the virus hiding somewhere that you cannot find it, whether you use 1 or 2 or 3 locations, and then a virus come out. So that's why a combination of different techniques and combination of multiple locations make sure is true negative, not false negative. Besides, false negative could be a reinfection by a mutated virus. That's possible. So those negative turn into positive. Patients can have all those above situations. The protective serum in the a portion of the blood was under the assumption that those people who was infected and generated protective antibody, or we simply put it as a protective bullet that could, which can be used to fight virus. So those are the bullet in the blood of the recovered patients. If you take the blood out, isolate the serum, and inject those serum into a sick person, it's just like a borrowing bullet or weapon from another person to help fighting the battle with the current patient. Or in other words, the current patient is hungry, you borrow a fish from another person to eat, and then he's not hungry anymore. A sick person borrowing the protective serum so that he can help him or her fighting the virus in his or her own body. But that's not going to last forever. Just like no matter how many fish they lend it to you, the fish run over. So that's why this is called passive protection. The other way will be active protection. That means show you how to fish, and then that's long lasting. That comes to the vaccine. The vaccine basically is a way to teach your immune system that when the virus comes, you fight the virus this way.